Good evening, everybody. Welcome. I've got a request, please. We're going to start in about a minute. So two things. One is, in the next minute, in the next 60 seconds, do me a favor. If you're way in the back, I would ask, please come up, grab an empty seat up front. Love to have these tables filled a little bit better. We've got an almost empty one right here. Prime seating, you'll be able to see the screen better. You'll be able to see the panelists better. You'll be able to see all the other participants. So if you could move up real quick, that would be great. It would be great to have these front tables filled as we get ready. Sure.
In order to heat up the thing, as soon as we're done talking from Hodge and you come up
Yes.
to do it, I'm going to sneak up and start to turn it on.
Perfect. You can do it. Whatever you need to do after. Man, you guys are pretty good. Ready to go? Okay. All right, good evening, everybody. Thank you very much for coming tonight. We're excited for the session. My name is Bob Woodward, and I am the publisher of the Telegraph Herald and TH Media, Vice President of Woodward Community Media, and on behalf of our employee owners, as well as our partners in crime here, the Dubuque Community Foundation of Greater Dubuque, we thank you for coming and talking about some of these important topics. This is our first one. We had a little bit of a hiatus, so maybe a little bit smaller crowd. Hopefully we'll continue to build a little bit more momentum as we finish up the remaining sessions. This is our fourth one. If you remember, we started off in August with housing, then we did workforce, then education in late October, early November. Now, tonight, health and wellness, and we've got arts and culture coming up next month. So a series of 7 of these, and we appreciate your coming and participating. A little reminder, a couple things. The goals for tonight. We're going to try and identify some topics, some issues. We've got a great keynote speaker from Hodge. We have a great panel and some excellent facilitators. But during the course of the evening and the conversation, our goal is to identify some of the topics and issues around health and wellness and some of the shortfalls that need to be addressed. We probably cannot get to all of them, so let's just recognize that. I will also say, and I think that there should be some pens and some note cards on the tables. Tell me if that's right or wrong. Thumb up, thumb down, thumb up. Okay, so we've got some of those on there. That's how, if you have questions, please write those down. We have people like Mike Fortman here from TH Media. We have some people who will be collecting those. I'll be collecting those, and we'll share them with facilitators. We probably won't get to all of those either, but that's okay. We'll save those and try and get them addressed later, but that's how we're going to collect questions tonight. So please participate in that way. In addition to identifying topics and issues, we're also going to identify resources, existing and needed. And this is part of the actionable component of these sessions. Our goal is not only to identify the topics and the issues, but the resources and the next steps so that when the evening rolls around, when it comes to a conclusion, we've got some next steps and some takeaways that can come from this event. We want to make these actionable. We want to be able to move forward and address some of these issues. So, without further delay, I want to introduce our keynote speaker tonight. Before that, I want to thank all of our sponsors. Tonight's lead sponsor is Hodge Companies, and if you want to applaud for them, you're more than welcome to do that. Thank you, Tim. Thank you, Connie, and thank you, Jordan, and everybody at Hodge for being the lead sponsor tonight. But we have other sponsors as well. There's been a lead sponsor for each evening. We've also had Northeast Iowa Community College, Greater Dubuque Development, Greed State Credit Union, John Deere, the Dubuque Area Chamber of Commerce, and Cottingham and Butler. All of them are taking turns, which each of the 7 sessions being the lead, but they're all contributing to the one as a whole. This important message, we had some keys that were turned in. It's a little key fob here. It's a Dodge. So if you drive a Dodge and you're missing your keys, let us know. I'll be right over here in the corner. Thank you, Mike. And the snack bar closes in, no, I'm kidding. The snack bar's open all night. So with that, I'd like to, setting the table, I'd like to ask Jordan Fullen to come up and share a few comments from Hodge, kind of set the table for our topic tonight. Please welcome Jordan Fullen.
Thank you, Bob. And thank you, everyone, for being here. I just wanted to start introducing myself. My name is Jordan Fullen. I'm Executive Vice President of HR and Safety at Hodge. Thank you, Bob and TH Media, for putting on tonight's event and for putting on this series. When Bob and Mike reached out to Tim in July of last year to ask us if we would support this event, it was honestly a very easy yes for our organization. And many of you may know that Hodge is a material handling and logistics company. Some of you may know that Hodge is family owned and operated. What some of you may not know about Hodge is what we believe drives our company's success. And we've studied this a lot over the last several years, and what we believe drives our success is treating everyone that we interact with like family. Whether that's our employees, our customers, our community partners, that's our mission, and that's what we believe drives our success. So when we were reached out to support diversity, equity, and inclusion, it was an easy yes, because to us, families are committed to one another, they're engaged with one another, they are supportive of each other's differences, and they are present in helping resolve each other's needs. And the challenges in whatever topic at hand. So a very easy match to who we are as an organization, and we're very grateful to help resolve and be a part of such an amazing topic. And when we got the opportunity, thank you for letting us pick the topic, the specific challenge that we wanted to address. Health and wellness was definitely at the top of our list. You can imagine with that family core value that taking care of individuals and truly caring for their health and wellness is important to us. And if you know our family a little bit, we may get a little adventurous at times. So just a very connected to who we are as a company and who we are as individuals. It's such a big topic, though, and I'm not going to stand up here and tell you my personal views or my personal solutions to the challenges, nor am I going to tell you what our company's programs and stances are. That's what our panelists are here for today, and I'm so very excited to learn from Alex on our data, community data, and learn from all of our panelists. But what I do hope to present is maybe a little inspiration through a couple stories. I'll try to keep them brief. And why I share these stories, I think oftentimes when we are presented with a challenge, we think we have to have some very big, grand gesture that's going to solve the entire challenge in one foul swoop. And that's always great, and if anyone has that solution tonight, I am in. I will help participate. But what is often more common and more likely is that we all choose one thing that is within our reach that may impact one person. And that one person being better off is amazing. So I'm going to tell a couple stories about one person that was better off. So the first is we were in a HR meeting, early 2022, and one of our HR team members said, "Hey, can I close out the meeting?" Of course. Now, what this individual shared, we weren't expecting, but what they shared was that during their annual preventative care visit this year, they were diagnosed with prostate cancer. And luckily, this individual was diagnosed early on, and they felt very comfortable with the care plan ahead of them. What they did share, though, during that time is that they're very grateful for the company's health and wellness program because they likely would have not been doing their preventative care visits that were almost ingrained in them as a habit through Hodge incentivizes participation in preventative care visits. And so they were very grateful that we had helped instill that habit in them. And I will say our entire HR team was in tears last week at the end of a call as this individual was able to share that they are now cancer-free, and they were able to resolve that need. Point being with this story is access to care. And for us as an employer, we were able to access to care and awareness of your health, encouraging those visits. We were able to connect to that and build that through our programs in this individual, and it saved his life. So one story. Second story, a little bit more meaningful, or maybe not more meaningful, that's the wrong word, but could maybe resonate more with your daily life. We had another employee, this one's a couple years old, who just woke up and they finally said, I had it. I'm done with feeling tired. I'm done with being overweight. I'm done with feeling like I can't keep up with my amazing kids who are doing so many great things. I need help. And they came to us. Luckily, we also offer health and wellness coaching to our employees. They got into this program was specific to weight loss. They lost 50 pounds. They dropped off multiple prescription medications. They had more energy, and they were just really excited about being able to be there for their children, be more active and involved in their children's lives. Point to that one. So the first one was access to care and really knowing your health. This one's a little different. It's just having resources and support and an accountability system to help you tackle those concerns. So again, why do I share those stories with you? It's not to tout off on Hodge's wellness program. It's to show that sometimes we can't tackle the big items, but we can listen and learn to one another. We have all of the programs that we have because we listened to other community members. We have a great partner. I'll give a shout out to Health Check 360, who's here locally in Dubuque, that partners with us on our employer wellness. And that's how we've been able to create those stories at Hodge. But I am quite confident that tonight, listening to our panelists and listening to Alex, we can all leave and have one takeaway that would create another story like the two I shared tonight. And if we can all leave this room and create one story, that is an amazing impact on our community. So I just want to thank all of you for being here tonight. I want to thank the TH and the Community Foundation for putting together such an amazing series, and I'm really looking forward to learning from all our panelists, and let's make sure we all leave with that one thing. Okay, thank you. Thank you, Bob.
That was perfect, Jordan. That's a great way to set the table and get some of the topics and issues out there. We want to start off before the panel with some data. Let's talk a little bit about where we were and where we are today. And the Community Foundation does a study, usually or planned to be every 5 years. Now 7 because of the delay with the pandemic. And so we're going to hear some data from Alex Baum, and he's going to share a little bit about some of the statistics, the health statistics here in Dubuque, what's getting better, what's getting worse, and what are some of the areas that need to be addressed. So, Alex?
Terrific. Thank you so much, Bob, and a big thank you to TH Media as well for partnering with us on this. This is such an inspiring and encouraging event, and I am thrilled to be able to listen to the panel that we have today, provide some expertise about what's taking place in our community. We're going to look at a little bit of the data. If you want to get up closer and more personal with it, a lot of it is posted up on the side of the room right now. But before we begin, I want to talk a little bit about the methodology for the community equity profile that we run, and specifically these middle boxes. We're hosting community conversations and a community survey that there is information about on your table. A big part of this process is getting those lived experience from our residents and finding out what people on the ground are experiencing when they interact with our health and wellness systems. So please take the time to fill those out and participate and spread the news about them. Getting into some of the data, I want to begin by talking about some of the chronic diseases that we have experiencing and what the change has been since our last equity profile. All of this information comes from the Behavioral Risk Factor Surveillance System, which is put out by the CDC every year and is what Iowa uses for measuring its outcomes and its progress against these public health numbers. So looking at some of those chronic diseases like diabetes or cardiovascular disease, you can see that since the last equity profile, we've seen incremental increases in pretty much all of these areas. Now, the flip side of the coin is looking at the contributing factors to that as well. So between 2014 and 2021, we didn't see much change in terms of binge drinking and exercise rates. We saw a drop in the percentage of respondents smoking, but we saw an increase in those who are overweight. And here, overweight means both overweight and obese, pretty much anyone with a BMI over 25. That's a little bit of the change that we've seen in terms of chronic diseases and then some of those risk factors that impact them. But another big thing that we're talking about in our community is the issue of brain health. And so still looking at the BRFSS, we can see that over the past 7 years, we have seen about a 10% increase in the number of respondents who have said that they have had a bad brain health day out of the past 30 days. So there has been a growing number in that regard. Interestingly, though, when you ask people about depression, we've seen the opposite. We've seen a decrease according to those numbers. I'm not sure what the reason for this is, but because there's a discrepancy, I thought we would look at something a little bit more local as well and talk about the brain health retreat rooms that are currently in a number of our schools. We're going to focus on the 2 rooms in Hempstead and Dubuque Senior because we have the most data about those. So you can see that between February of last year and December, we've had over 2,100 students make over 5,500 visits to these rooms, which are rooms where students and staff can prioritize their brain health during the school day. As part of the data collection at these retreat rooms, the school district also collects what the mood is of students when they enter the room and what their mood is when they exit. So on the left, we have calmer, more content moods, going up to the right with more out of control or upset moods. And you can see upon entering, there is a little bit more of a bell curve type shape, but it improves significantly upon exiting the room. Some interesting local findings from our school district. Something we don't talk about as much that we wanted to bring up was the issue of sexually transmitted infections or STDs. We have been seeing a significant growth in chlamydia and gonorrhea in Dubuque over the last several years. Some big increases since 2014 and even larger ones since 2016 when there was at its lowest point. Moving on from that discussion, the flip side of some of these chronic diseases is the financial aspect, the access that Jordan talked about. This data shows the percent of uninsured people within the city of Dubuque broken down by race and ethnicity. And as you can see, we've actually had some substantial improvements since 2014. So we have seen a drop in the percent of the population that is uninsured. A lot of this is driven by the decline in our white population, which is our larger demographic. But I also want to point out this Pacific Islander number. At the end of 2020, our Marshallese residents were able to finally win renewed access to Medicare and Medicaid after a 25-year period of not having access to that. So that was a huge event for our local Pacific Islander population, and I'm hopeful to see this number continue to decline in years going forward. Now, not all the news is positive, however, because if we look at our Black and Latino population, we see that there's actually been a rise in the percent that are uninsured, according to this data. Trying to look at it through some other factors as well, if we look broken down by gender, we can see that women have had a pretty substantial decrease in the percentage of the population that is uninsured. And when we look at it broken down by level of income, we see declines mostly across the board, especially in those lower income brackets. The exception being 75,000 to 100,000, where there's actually been a little bit of an increase since the last equity profile. And now the last thing that I want to touch on here is food insecurity. This is a chart that is looking at the percentage of our community, both the general population and children, who are considered food insecure. And you can see that we have had a pretty steady decline over the past 7 years, going down to the lowest point that we've had in recent history, which is a great achievement, I think, for our community, according to this data. Now that we've kind of set the stage with a little bit of this data, I want to turn it back over to Bob and to the panel to really dig into what's taking place within our community. Thanks so much, Bob.
Thanks, Alex. All right, I'd like to invite our panelists and our facilitators to come up. Remind you, we've got a couple of microphones for each side of the stage here. And this is where, again, some of the topics will get delved into a little bit more deeply. While they're doing that, I'd like to remind you, if you know of somebody who couldn't be here tonight, we are recording and live streaming this, so it's available for later viewing if somebody wants to catch that. And so there's a great opportunity to catch the live stream. Our two facilitators tonight are Amy Gilligan from TH Media, Executive Editor of the Telegraph Herald, and Anderson Sansey from the Office of Shared Prosperity from the City of Dubuque. And Amy's chomping at the bit to get this microphone. So please welcome our facilitators, and the panelists will introduce themselves.
Thank you, Bob. Thank you to our panelists. I'm really excited about the group we've got together tonight. So we're going to get right to it. So we'll ask you some questions as we do. Everybody doesn't have to answer every one, but if you have thoughts to add, please feel free to, motion and pass the mic amongst yourselves. But let's start here with you, Melissa, and if you would just introduce yourself and tell the folks what you do, and then we'll just go down the line so everybody knows who's speaking with us tonight.
My name is Melissa Springer, and I am our Vice President of Mission Integration for Mercy One. I'm a mental health therapist by training. I've worked with Mercy for 25 years, the most recent 4 years, more with our mission-driven growth and our brain health care. So it's my pleasure to be here tonight, and we have a good crew up here.
Good evening. My name is Eric Rosinos. I'm the Diversity, Equity, and Inclusion Program Manager with Unity Point Health. I'm based out of the Quad Cities, but we do a lot of, we partner a lot with throughout all of our Unity Point Health affiliates. I do have to just add, being in this room, I'm not from Dubuque. This is probably the nicest room I've presented in, and it feels like home. I'm an ordained minister before I got into healthcare, so just being in this setting feels really, really exciting.
Good evening, everybody. My name is Brittany Hubanks. I am the manager for the Unity Point Visiting Nurse Association.
A little louder one more time, sorry.
I usually don't get asked to talk louder. That's a first for me. My name is Brittany Hubanks. I am the manager for the Unity Point Visiting Nurse Association. Happy to be here tonight.
Hi, I'm Mary Rose Corrigan. I'm Public Health Director for the City of Dubuque and a lifelong wellness and preventative health advocate.
Hi, my name is Cassie Foley, and I'm with Crescent Community Health Center as the Health and Wellness Coordinator for staff and patients.
Good evening. My name is Dustin Alfred, community health worker at Crescent Community Health Clinic. Also working very directly with the Marshallese and the Micronesian community, Pacific Islander.
All right, I'm getting a few signals out there, so speak close into the mic, loud and proud, and articulate. Father Dan's going to give me the signal if he can't hear you. So, so let's get started, and we want to talk. I'd like to hear first about just kind of putting on the table what are some of the current health challenges that you see, the health and wellness disparities in our community, and then we want to talk a little bit about what your various organizations are doing to address those, to define those issues. So. Anybody who wants to start can jump in.
I'll go. Well, I think that for many people, health does not become a priority until they are in crisis or really sick or can't function such as going to work or those kinds of things, because people of vulnerable populations, lower socioeconomic means, or facing other barriers, getting a wellness preventative check or going to the dentist is not at the top of their list. And when we go back to the basics of Maslow's hierarchy of needs, we know that some of those other basic needs are much more important to people who are struggling. And so I think the social determinants of health, like transportation, education, income, housing, all of those things factor into a person's overall health. And so when we're talking about health, we have to look at the whole person, their living environment, their skills, their barriers, their challenges, because if they're not fixed, the person is never going to get to a true health outcome. So I think our community has gotten a lot better about looking at the social determinants of health and addressing neighborhood issues, employment, transportation, job opportunities. They all factor into that.
I would just add to that, when I think about the pandemic lived experience that we have all just come through, it's never been more important to focus on preventative measures and making sure people have access. Many of you in this room have heard me talk about brain health, as that's where my expertise lies. But when you really think about it, we had an opioid epidemic collide with a global pandemic that is now enrobed in a suicide epidemic, all of these converging upon each other. So I think with the data that Alex shared and the Community Foundation's data and the uptick in adolescents and young adults experiencing anxieties and stressors and the use of the brain health rooms, I think there's some real opportunity that lies there in terms of ongoing need that's going to require our attention. We look at healthcare forecasting, and within the next 10 years, they say we'll see 30% increases in the need for pediatric brain health, adolescent brain health, adult brain health. How are we positioned as a community to serve our community in that regard? How can we leverage what we all have together to do so?
I just want to add some of the challenges that we face in the clinic is following up with our patients, communication barrier. When we refer patients outside of Crescent, it's usually difficult for the patient to get there, how they get there, and who to talk to when they get there is some of the barriers with the community challenges.
Since we're talking about some of the challenges and barriers, can you talk about potentially some of the strategies or things your organization is doing to remove some of those barriers?
Sure. So we have an initiative that we call Medicine in the Barbershop. What we have realized is we have all this data, and we've all had sort of these aha moments, but I think it's so easy for us to kind of fall into this build it and they will come mentality, and that doesn't address the issue. So when we launched the Medicine in the Barbershop, we partnered with a local barber who sees hundreds of Black African American not patients. What is it?
Customers.
Clients, customers. Yeah. Every week, community members. Every week, he sees them, and he says, he was telling us they're asking all these questions, and I don't know what to tell them. So we partnered with him, and we took a fourth of his barbershop. We were able to hook him up with some iPads and some resources. What we found is that a lot of the people that were coming to his shop were interested, had the questions, but when it came to making the step to go see a provider, it wasn't happening. So we brought the providers to them, and now we host monthly, you could say, clinics that could come and provide blood pressure screenings or whatnot. We also taught the owner how to provide these for them. so that even if they did not immediately take a step towards going to a clinic or being seen by a provider, actually what we found is a lot of them did not have a provider that they would see. So we began to address some of those, and we're seeing pretty quickly that once you begin to provide those settings and you meet the community in the places where they congregate, for lack of better words, you're going to begin to see that uptick.
Brittany, you look like you're nodding with some of the things that Eric is saying there. Can you give us a little perspective from the VNA and some of the things you're seeing?
Yeah, absolutely. So this is what VNA does every day. This is what we see come through our doors every day. And while we may not be able to fix the problem in-house, we know who can. And this goes back to Melissa's point of everyone working together. We have a program called Ryan White. I believe one of our staff is actually in the audience tonight, that assists individuals who are living with HIV and AIDS get to infectious disease appointments. Infectious disease is something that there's not a lot of care for here in Dubuque. So we were having our patients travel hours to see their physician to get their needed HIV medication. What we were able to do in conjunction with Unity Point Health was to bring telehealth to Dubuque for infectious disease for this population. We were able to set it up at a local clinic. We were able to get them transportation assistance to this appointment, and they were able to see their provider without ever having to worry about how they're going to get to an appointment 2 hours away. We also at VNA have the luxury of working with the Iowa Health and Human Services on a number of initiatives and grant programs. And one, I think, really impactful thing that VNA does is every new family who is on state insurance, Medicaid, Title 19, those individuals, we get a list of everyone who's eligible each month. And what that allows us to do is do targeted outreach and get in touch with those individuals. Statistically, individuals who are on our state and Medicaid insurance are those who are of vulnerable populations, lower socioeconomic status. They might be from different cultural backgrounds and things of that nature, but that allows us time to do targeted health education, talk to them about how to use their benefits, what the state insurance does provide to them, talk about providers, connect them to a provider that will take their insurance. And that at its key, that health education and health education comprehension. So many times they get education, and even, I go to the doctor and I'm like, I have no idea what they just said to me. I don't understand this. So something that's on their level that they can understand and really comprehend how to access all of that care.
So we hear targeted efforts to get into communities. We hear using technology as a way to make it more accessible. Can Crescent talk about some of your community health worker positions that you've created also to meet residents where they're at and to gauge underserved populations?
So I can talk about this, and then Dustin can touch if I miss anything. But we're constantly looking for grants and funding for certain things like cell phones for people that can't afford them. They can't get reminder calls or lab results calls or things like that without a phone. They can't call to set up an appointment without a phone. Other things are rides to appointments. So we have a grant for gas cards. So maybe you have a friend with a car, but you don't, or you don't have any money to give them. That, as well as, personally, I'm working with a grant right now where I give away 10 free meal kits every month, and I do a demo video on how to cook that, give all the ingredients, and then have them take that home. It's something that's affordable that hopefully they can take into the future and use again. So always just trying to find grants and funding that we can help people even just a little bit, whether it's with education or a piece of equipment or something that they can take to utilize to better their daily quality of life.
And Cassie, can you or Dustin talk a little bit about how you have, what you've done to communicate with clients who might not be native English speakers?
As a community health worker, the trust between us and the patient is really big. having somebody that speaks the native language is really a big benefit in the clinic, not with just the Micronesians, with the Hispanics. I think we have seen more increase in the Marshallese coming to Iowa because of having community health workers that speak their language and know what's going on and can be an advocate and can be somebody who they can trust as a community.
Yeah, that's a tremendous asset at Crescent. So what about the VNA? How do you handle that?
So at the VNA, we have a lot of tools in our toolbox for this. Like Crescent, we also have a Marshallese community connector, community health worker. So doing similar things with help with translation for appointments or written materials. We also work very closely with Dubuque Refugee for Children. They work with South American, Hispanic families that are in the area, getting them access to care. We partner with that group quite a lot, and they offer volunteer translators that speak Spanish and other South American language, so we do work with them very routinely. We also have Language Line, which is by phone. It can get a little awkward and doesn't always work the best, so we were looking at some additional technology similar to telehealth. We were actually able to work with the Medicaid managed care organization, AmeriGroup, on a pilot project that gave our agency iPads. AmeriGroup allows us to use it with non-AmeriGroup members, so we can use it with anyone that walks in our doors. Any of our staff can take it out in the community with them if they're going to meet a family at home or at an appointment of some kind. But what that gives us access to is video telehealth translation in over 100 languages, and it also gives us the ability to do sign language with a family if they are hearing impaired. And so that has been a great tool that we've been able to add to our toolbox. It makes the experience more personal when it's not just someone on a phone. If you can't have somebody physically there, having them on video screen, it just adds a level of comfort for the family or the patient that we are providing care for or assisting in getting care.
Is there any education or assistance to help those who may not know how to use the technology?
So anytime that they're using that technology, one of our staff is with them. So a family or an individual doesn't have to worry about, I don't know how to do this, I don't know what to push. We're there to walk alongside of them in that journey to make sure that they can get that and access that.
So I want to transition to this thing Mary Rose and I are working on, and many of you. It's called the Community Health Needs Assessment. And Mary Rose, for those who are in the audience right now who are not aware of what that is, can you talk about it and how you guys, majority of you or some of you, work together to put that together?
Sure. The Community Health Needs Assessment is a process we do throughout the county every 3 to 5 years. And just about everybody on this stage is a member of our steering committee. And we're just getting ready to kick off a community electronic survey to get input on community health needs. And believe me, everything going on here tonight is going to be very helpful. But I will say in the last 3 or 4 rounds of that, we've learned that we have to not just look at our basic, for instance, diabetes rates or obesity rates. We have to dig down to the data like Alex did and say, is all the groups in the community affected the same? And it becomes obvious that, this is an issue for this group, but not this group, so we need to focus in on that. We're getting better and better at that with every cycle, and this year that we're embarking on this, Anderson's staff and Crescent staff, who focus on vulnerable populations, are going to be on our steering committee and help do targeted, pointed outreach in other ways other than a virtual electronic survey, and get input from patients and focus groups and different methods. And also, part of that community health needs assessment is called a health improvement plan. It's, okay, what are the highest needs? what can we set as goals and objectives for the community, not necessarily, just for one particular agency, but what kind of things does the community need? And we want to get input from people on how to develop those goals that are doable and measurable, and that organizations throughout the community can take on. So we're excited to be launching this phase of it, and you'll be hearing more about it as we gather input.
Okay, well, we've talked about some of the obstacles that prevent people from getting, you talked about transportation and technology. Let's talk a little bit about the health factors that contribute to these disparities. Particularly, let's start with adults. I know we can talk about kids too, but let's talk about some of the health factors that you see that contribute to these inequities.
Well, I think in terms of health and wellness, it's somewhat of an equal opportunity issue. We can see that in our obesity rates. There are some health disparities in certain populations that have higher obesity rates than the population overall, but it's a real struggle, and the rates keep going up. We have it every year as a top need in our community, and it just keeps going up. And I think it's another thing that there's not one easy fix. It's a lifestyle and a behavior issue, and we have to start modifying our environment and our policies to address those issues. So, I would rank obesity and lack of physical activity very high, because they do contribute to a lot of chronic disease for adults especially. They start in childhood, but it is definitely an adult issue.
I think a lot of people, oral health or dental care is an area that it might not pop up in your mind when you think of health and wellness. We all typically go to medical things, even myself, but oral health care, dental care for adults and children, but individuals who are uninsured or who have a state-based insurance program like Medicaid, the dental provider network for the volume of patients that are in need of that care is small, and so it can be very difficult for individuals in our area to find a dentist who can see them timely and also is willing to take new Medicaid or willing to take Medicaid at all. So when you look at that demographic of the population, that is it's a definite need. And oftentimes when they do present for care, it's because they're having an emergent issue. So they're going to urgent cares or our local emergency rooms, or they're calling VNA or Crescent. And the dentists that do take Medicaid in our area, there's not enough to go around, and they do what they can, but it's very difficult to get seen timely or to get seen at all if you are a part of that insurance type.
I would just add, during pandemic, Unity Point and Mercy One needed to move forward with a community health needs assessment. We typically do that collaboratively with the city and the county, again, to leverage everything that we bring to the table. We needed to move forward in pandemic. We were not allowed extensions like city and county government. So it's really exciting now to kind of circle back into that process and bring us back to our collaborative, because we found obesity to be just a significant community health need, severe, needing a robust health improvement plan. I see Alex's community data that just highlights obesity and how that is continuing to increase. So it'll be interesting now as we come together and resurvey, being mindful and intentional about making sure that we are getting these surveys to those we need to hear from, that we're translating that document into a way that people can read and in a reading level that people understand. And I would suspect, as Mary Rose noted, that we will continue to see obesity as something that we will want to all champion in this community moving forward as it contributes to disease. And I think of some of our mission-driven growth at Mercy One. Part of our health improvement plan that Mary Rose mentioned was to have this mobile unit that would go out and it would be with people where they are. And one thing that it has done, mostly vaccination early on in this first year, but taking people nutrient-dense food in areas where that might be scarce and making sure people have access, and just some basic, simple education about nutrition or about physical activity and the importance of that. So I know it was our pleasure to work with Unity Point through that process. Hillcrest joined in with us, but now to get back with the county and the city and Crescent and to all come together again, that's really what it's going to take, I feel, to make some big difference here.
You know, one of the exciting things that comes to my mind as I think about Hodge Company, I've had the privilege to work for them when I was a little younger, and one of the things I remember vividly is this idea of this run for troops where they used to support the veterans, the military folks, and they had a variety of people who would get out together and exercise. We recognize some of the biggest health disparities is downtown in this area, so what would that look like to have a run for troops or run for something down here and coordinate it collectively? I do want to mention right now that on your table, there's still opportunities to write a question, and we have some individuals on the side that will come and pick it up, and we will answer those questions for you. So please, again, I see some people putting their hands up, grab those cards and bring them. But Ms. Cassidy, did you have a response to that as well?
Yeah, so I was just going to touch on that. I work directly with medical providers. Usually that's how a patient first starts seeing me. But something in the recent last year or so that we've seen directly impact patients is using preventative wellness like the gym or health coaching and attending and showing up for their behavioral health appointments. So we see success when people come to the gym or meet with me and then in turn actually show up and stick through whatever behavioral health plan they might have. So that was something that I've worked with directly with behavioral health on that maybe hasn't been considered in the past, and that we've seen direct success with patients doing both and showing up for both.
I can go with the first question. It says, does Crescent Community Health or other providers provide health care to uninsured people?
Yes. Yep, we have a sliding fee scale, so if you don't have insurance, you can meet with our insurance specialists. They look at what your income is or lack thereof, and then your payment is decided based on what you can afford.
Okay.
This question goes back to that issue of obesity. What are the top environmental or policies that need to be addressed to tackle obesity? Are there things that are unique to this area in this regard?
Well, I'll talk about some community ones, and I'll talk about some organizational ones. I think, take for instance our B Branch Parkway. That is a great way to address community activity and obesity. It provides beauty, it provides a way to recreate, it provides a transportation link, it provides a bike trail, and it has a lot of amenities for a neighborhood that, quite frankly, was neglected for a long time and needed those amenities. So people, anybody can use that, but you have to think of it as a space to socialize, exercise, have a meditation moment, whatever you will, and not to mention it protects our neighborhoods environmentally. So policy changes like that a community can integrate along with our trail plan, our transportation plan, those kinds of things to make the community more connected, not just by a car, but by other means of transportation, walking, biking, public transit. Another idea is a policy, and that's things that public places, work sites, restaurants can implement as part of their policies. So for instance, an institution could have a policy of, we don't serve Cheetos or chips out of a bag, for instance. That's a very simple way to look at it. But they can make some food policies, like the schools do. At celebrations, you know, we have to have fruit, vegetable, this, that, included in the array. So you can do things like that for your own organization. You have a policy of, you know, offering breaks for employees to take walks or whatever it is. So there are things individual organizations can do, like Hodge illustrated, that they do things for their employees, and you don't have to have a fancy wellness program to do it. I think we could do things at our local festivals and say, hey, can all the vendors serve one healthy option that isn't fried or has cheese on it, for instance?
Wait a minute now. Wait a minute.
I'm super glad we ordered the fruit tonight, I'll tell you that much.
I said one option, Anderson.
Go eat the fruit, people.
But it's small things like that, and you know, people try things and they're like, hey, that's not so bad, right? It's like Allie with her food, Cassie, excuse me, with her food kits. She may have something that a person never tried before. That's not a policy issue, but I think our communities can make policies without making laws or rules to improve health.
This is a good one right here. I recently heard 75% of our health dollars go to chronic preventable disease. This is unsustainable. What are individual healthcare practitioners doing about this?
What was the first part of it? Could you say it again?
The amount of money that is spent on our chronic preventative disease. So are health practitioners doing anything to work with the individuals to solve their issues?
So at Crescent, if you're meeting with a provider maybe for the first time or something has recently come up, so say you're now pre-diabetic or recently you have high blood pressure or your cholesterol is showing that it's not looking so good, they usually come and see me and we'll kind of set a guideline like, hey, I'm going to see you back in 3 months. This is important. I need you to engage in physical activity or health coaching or both. And then we're going to revisit and we're going to rerun the blood work. And I'm free to patients, so that's something that we tried to use quite a bit because then if the patient comes back and has to go on that medication, it's obviously not great for everybody involved.
Well, while you've got it there, Cassie, let me ask you this kind of, you could speak to this. So how do you get the message out to those who don't have insurance that your services are available or that there is a sliding scale available?
So Angela Petchy at Crescent does outreach and enrollment for the community. She's at as many events as she can be. If you haven't met her yet, I would be shocked. But she tries to advertise that as much as possible. We try to talk about it as much as possible and put things on the internet, printable information, anything like that. Obviously in diverse populations, advertising that way, having people that they can trust where if they're new to town, people are like, you should go to Crescent.
Similar for VNA or?
Yeah, so it's really important to meet the population where they're at. So we do a lot of outreach events with numerous community partners, but we also target groups such as the Marshallese community. We participated with them in like the Marshallese Constitution Day celebration and their Man It Day celebration. We're very engaged with the LEAD group, which is through NICC, which is Hispanic and South American Latinx group, and participate in their events, as well as participating with in events with like our local NAACP chapter, Anderson's wonderful Back to School Bash every year. We try to get out to as much community-based events as we can, just so that we have the opportunity to interact with individuals in our community, because you never know when you're going to come across somebody with a need. And it might not be who you would ever dream of having a need. Could be your neighbors, could be your friends. It doesn't necessarily have to be, you know, these siloed different populations. The needs are throughout this entire community. So we try to get out and go to as many events as we possibly can and really do that outreach and get those boots on the ground.
I think the constitutional days that you mentioned, that's been a highlight for me over the past year or so, working with the VNA and Crescent and the Iowa Department of Public Health and our county health department to deliver care to people where they are, to have this authentic presence at something that means so much to this population, this ethnically diverse population that's disproportionately impacted by tuberculosis or diabetes, or was disproportionately impacted initially when the COVID pandemic started and what that looked like. But that ability to be present in your community, to transform your community by being with people at celebrations and festivals and places that are important to them, and then deliver care or treatment or assessment that helps them have an improved quality of life with one of those chronic diseases. I mean, that is profound, and that is where our continued opportunity lies. So to the extent we can help each other to know where to be and how to do that. I loved what Jordan shared about Hodge's mission statement and treating people like family. And I think at Mercy One, you know, we say we are just this reverent, compassionate, healing ministry, right? We hold people. We honor the sacredness and dignity of people. And that's what this work will entail, to encourage people to seek preventative care, to encourage people to work on their diets, to encourage people to be more active, to, you know, it will take us all to lift and to be with in a transforming way, transform, to lift up, you know, Eric and I holding somebody so that they can get what they need for their care and for their wellness. I think that is so beautiful. That has been, in my 30-year career, a highlight, Constitutional Days with our Marshallese friends. And so I just wanted to mention that to your point. That was something.
Thank you so much.
Yeah.
I do want to lift up workforce issues. I believe we all know that workforce is a huge challenge throughout the country. So I'm curious, what is your organization doing specifically to retain, I like to use that first, recruit a diverse workforce, right? So again, what is your organization specifically doing to retain and recruit a diverse workforce?
So at Unity Point Health in 2022, we decided to host what we called Conversations on Belonging. And these were intended to invite our employees to have anonymous conversations with people from my team, on our DEI team, and from HR, and begin to just tell us everything you're experiencing in the workplace, the good, the bad, the ugly, and there was a series of questions. And what we got out of it is that a lot of team members, specifically within Unity Point Health, are having a difficult time to address or to bring any issues to the forefront because of fear of either retaliation or of nothing getting done. I can't tell you how many times we heard people say, I'm just tired of bringing things up because nothing gets done. So what we did is, out of these conversations on belonging, we then reported it to our management team, the people that can change policies, the people that have influence. And so we're starting to look at this, the beginning of this year, we're starting to look at, okay, this is what our employees are saying, and with the crazy turnover that's happening specifically in healthcare, there's this, what I would call exodus in healthcare, where number one, team members feel like they're underpaid, overworked, right? And I'm assuming that's across the board, underpaid, overworked. So what are some of the things that we can begin to address? These are the questions we're asking, so that our team members, number one, feel like, hey, when I say something, something's being done, and I'm not just being tabled. Number two, I have a voice and influence in the things, in the changes that are coming. So we then invited the team members that took the risk of being a part of these focus groups and invited them to join in some of the employee resource groups and join in the committees so that they could then turn around and say, and begin to do some of the work. And those were the team members that are helping us do the work with our communities, like I mentioned, with the medicine, the barbershop, and some other initiatives that we have. But I think being very intentional, just continuing to hear the voice and then doing something about it. that's important.
I would say for the city of Dubuque, the big word is flexibility. The things that have been developed with our organization in terms of work schedules, being very family friendly, being supportive of health, brain health, and systems to support employees for those needs. We're developing more culture of caring organization, and these things take time, I think, but I think flexibility is a big one, and not to mention just general education of employees on diversity, equity, and inclusion, and some of those kinds of, there's a lot of committee work, but I would say flexibility is a big one, and accommodating people with their differences and needs, who can get the job done with a slight accommodation, and that has made a big difference also.
I would just add, in terms of recruitment, you know, in many ways, healthcare has been on her knees for a while here with the exodus that Eric mentioned, and I think what's been really neat is to see people that we work with every day and kind of tapping them and saying, I see how hard you work, I see your dedication. What would you think about a development opportunity to do something else within this organization? And being intentional about making sure people have opportunities for advancement or to work in other positions, or perhaps receive additional credentials or training or schooling on the job to be able to, you know, have an increased wage, have a different type of career, maybe something they didn't think they would qualify for, they could do, or they would be eligible for. And sometimes it just takes a little encouragement. And I met with somebody yesterday and just sat with them in my office, and I said, have you ever thought about getting your CNA? Like, I think, you know, you'd be good. What can we do to help you do that, you know? So looking at who's in front of us, especially as that talent pipeline is dried up a little bit. And then also, one more point is just recruiting from ethnically diverse populations. We had to translate documents of our job vacancies and then make sure we had those at the Multicultural Family Center, in different places, on the Jewel, wherever it was, the library, so people could read the vacancies, the opportunities in a language that they knew what was available, and then helping them to feel welcome, and that opportunity is there for them. And I think there is a greater opportunity for us to do that. And we have some great leadership that's really kind of spearheading that, and I'm sure at Unity Point as well, because we have to, right? We're in a position that we have to do that, and we want to do that. And we want to, through our diversity, equity, and inclusion efforts, make sure people know that we have opportunities, and that we want them to work with us, and we want them to serve with us. And so that's exciting. I think over the past 2 years we've seen that we've been tracking that ethnicity new hire data, and we've seen it increase. And so, you know, at 2 years of work, and you begin to see just a little bit of fruit of your effort there.
Mm-hmm.
Well, that's real good. One of the things that I do want to give a shout out to is Opportunity Dubuque, with Greater Dubuque and NICC working collectively to fill those workforce gaps. So a big shout out. If you know anyone who's looking to skill up and train and to get into the health profession, there is a program called Opportunity Dubuque that is designed to assist that. Amy?
Yeah, our time here always goes so fast, but I've got a few more questions I'd like to throw out, so maybe we can just do some quick hits and a couple of you can jump in on answers to some of these. So this one says, what special issues or barriers do you find for senior citizens, and what can be done to address those?
I think seniors, one of the most important things to keep seniors healthy is socialization. And I think the more opportunities we can provide for that and market it, because we have people who are elderly and live alone, or maybe with one other person, And they too have social determinants of health, and maybe they can't drive anymore, they can't get out as much. Socialization, social interaction, I think, is key to staying healthy and being vibrant as people age. So we have to keep those opportunities in mind and make sure people know about them.
Also, we talked about the exodus in the healthcare field and trying to recruit talent in. One of the areas that we see is home-based CNA care. So staff that can go in to provide simple self-care, such as maybe bathing assistance and blood pressure checks, or just some light homemaking, light maintenance cleaning that can allow someone to remain in their home with just minimal support. Without those services, individuals that maybe would have been able to stay in their home with a little bit of support are looking at things like going into long-term care before they might actually need it. One of the areas that has always been one of the hardest positions for us to fill is our home-based home care aide, homemaking staff that provide that service to the elderly and those individuals that might have some disabilities in our community. And without that small gap filler, you might be faced with a situation where someone doesn't have support of a family member that could come and provide that minimal level of care at their home, who now might have to go into a long-term care setting, which from a health care perspective cost is higher, and obviously not necessarily might not be the best outcome for that individual at that time. So that's, I think, one of the other barriers, just how to recruit that workforce field and get those built back up, because it's not just our agency, it's other agencies that offer the same service in our community that are also struggling to maintain staffing for that.
I'm going to combine these two because they're very similar, related to data, and feel free, anyone can jump in and answer this. The question is related to how is your organization specifically utilizing the data to address disparities? So how is your organization utilizing the data to address disparities?
We try to look at any data source that provides breakdown by race, ethnicity, age, education. Sometimes in our community that's really hard because we have smaller populations in some of those groups. And the other thing is, I think many of our providers and just organizations are not cognizant about collecting that information. And so if you don't collect it, you don't know. And I think that's one weakness we have. I think we all have to get better at collecting good demographic information, whether it's on our employees or our patients or our clients, whatever, because then you can start to point out the differences. A lot of our data comes from Crescent, thankfully, because they have to track. You track when the firstborn is potty trained, I swear, because they track a lot of data, and it's very useful in pointing out health disparities in our community on a regular basis. So I think data collection is a big need also, and the more we can all work to collect good, accurate data, the better.
I can just touch on that. We are required to track a lot of our data for funding, so we wouldn't be open if we didn't track certain measurements and then meet on those measurements every year and try to improve on those measurements. So it's with patient surveys or when you see your provider and all of those questions that you get asked when you sit down. They're not just trying to be annoying, that's because we're trying to improve those measurements, and we get graded every year on those improvements or lack thereof if we're not doing better.
I just want to say we've got a lot of people here tonight that came out because they're invested and they care about this issue, and maybe they're thinking about what can I do to help. Give me a quick hit of what your most immediate needs are that could use resources.
Well, you can walk the talk, right? We all want to be healthier. We need to be examples for our children and our coworkers, our families, our relatives. And you do that by what you do when you're with them and what ideas you come up with for fun and suggestions you make to organizations that provide services. When you go to a restaurant, ask for a healthy option. Start asking, you know. Maybe they'll get the message. I think living and breathing health and wellness and trying to bring in people who don't normally have those lifestyle habits. You know, maybe suggest to them, hey, come along on this walk, just try it out, try this new food, I'll help you get to the doctor, I'll go with you. It may start small.
I think of the parable of the Good Samaritan. I'm sure many of you know that, but just that question of who is my neighbor, that we're all each other's neighbor, and sometimes it's easy to walk by because we're in hurried, busy days, but taking the time to offer compassion, to enter into the suffering of another and kind of journey with them through what they're experiencing. So I think that's a simple thing we can all take on and probably commit to tonight. We're going to check in on our neighbors. We're going to just be kind and loving and welcoming and show mercy and give people grace. We've all been through some tough years here where we haven't had connectedness. I think of the seniors, you know, and the importance of socialization that you were talking about, and just inviting them in to Finley or to Mercy to serve as maybe volunteers or ambassadors, just again for that connectedness and that socialization. But check in on your neighbors. This is life-threatening. You know, we have people taking their lives to suicide, people that are seemingly otherwise functional, young adults. Stigma weighs in. Check in. How are you doing? How are things going? This has been tough. How are you doing today? It's good to be with you, and just having those conversations, I think, just entering in with people and inviting those conversations about wellness and the importance of, you know, mammograms and the dental checkups and all of that balance in our lives. So important now. Who is my neighbor? And that's something I think we can all commit to as we walk out of here tonight. That's an easy one.
I like that. I think we're going to have to leave it there. We want an opportunity for you folks to come down and visit with some of the audience members. Some folks may have specific questions for you. So thank you to our panelists, Melissa, Eric, Brittany, Mary Rose, Cassie, Dustin. Thank you for being here. You guys did a great job. My colleague Anderson. I'm going to turn it over to Bob.
Thank you, Amy. And Amy and Anderson did a phenomenal job on the facilitation. Thank you, both Amy and Anderson. I also want to thank the panel, especially Eric Racinos, who came all the way up from the Quad Cities tonight to be with us, and appreciate him coming up from Unity Point and sharing his thoughts. Here are some takeaways that I wrote down. We want to make this actionable. Here are some of the things that I wrote. We want to focus as much on preventative measures as we can on working on issues that arise as a crisis. So we want to get ahead of things a little bit and focus on wellness. We need to address communication barriers is a big one, and as well as knowledge barriers. We need to take healthcare to where people are. I loved the medicine in the barbershop concept. And so how can we do more with that? How can we take medicine out to people and make it more increase that awareness, increase their knowledge, and increase their access. I also noted that we have, I think, infectious disease care shortage. We're partly addressing that with telehealth, but there are maybe some other opportunities there. Transportation continues to be a challenge, and we've heard this consistently on almost all of the topics so far in our series. Connecting people with benefits and then providers. And again, helping people find providers and understand what their benefits are, especially if they're on Medicaid or state insurance. I mentioned communication, more translators, and using technology and other methods to help bridge the communication gap. I've also got more access to dental care in particular is an area that we need to work on. And specifically, and I feel really bad about this because I had my annual physical today, and I don't want to tell you the advice I got, the biggest I got is you need to lose some weight. And I think a lot of us are still carrying a few COVID pounds. But obesity is like number one, and it's one of the biggest challenges. So how do we get I guess I would say, obesity measures, and how can we tackle that and take it where they are? I love the concept of doing more in the Bee Branch area because it is beautiful, but it also provides so many opportunities with the trails and the area down there. How can we do more to help people understand about obesity and address it? How can we, we talked about a diverse workforce, reducing some of that fear and concern about inaction and the stigma of asking for help. And as an employer or as a friend or as a neighbor, we can do that. How do we address the senior citizens? Socialization, number one, important factor, and there's others as well. Or just helping them get to the doctor or helping them understand what their doctor is telling them. And again, walking the talk, asking for healthy options at the restaurants, at the festivals, and so on. Those are some of the takeaways I have. I hope you have some as well. So I would share those as some immediate, and some of those are easy and some of them a little bit harder. I also want to mention that we have community conversations that are going to be going on. So we're not done with this topic yet. You'll have the opportunity to share your thoughts about health and wellness with the Community Foundation's Health and Wellness Community Conversations. There are sheets on your tables. They've got dates coming up here on January 19th, 24th, and 31st. You can go online and register, and if you have questions, you can contact Clara Lopez-Ortiz. And so I guess I'd like to finally finish by thanking our sponsors again, our partners at the Community Foundation of Greater Dubuque. Have been great partners. All of our sponsors of this entire series, and especially tonight, the Hodge Company. I think it's awesome that we heard a lot of great examples, not only from Jordan, but from other people about how Hodge is walking the talk. So appreciate the sponsors. So thank you very much, everybody at Hodge and all of the sponsors tonight. Please feel free to stick around, mingle. There's still some food left in the back. Lots of food left, Mary Jo tells me. We've also got a bar if you'd like to get a soft drink or a alcoholic refreshing. And come back, what? And yes, and our next session is Wednesday, February 8th. Same location, Steeple Square. So Eric, feel free to come back. And so please come back. And our topic there will be arts and culture. And we've got a couple of special facilitators for that. So with that, thank you all for coming tonight. And please stick around.
Ask you a question about that food.
Okay.